Hey, 12 Church, this is Pastor David. And for those of you that are familiar with our church or you call our church your home, we've been in the middle of a series that we've called Out of My Mind. And what we've been talking about is how the gospel of Jesus Christ and God's word speak to our mental health, how it informs and affects the way we think. We talked last week in the first part of our series about how Jesus commands us to worship him with all of our mind. And the Bible's got a lot to say on the subject. And as I shared with you, coming out of a pandemic, there's a lot of issues likely that are concerning mental health that we're not even aware of just yet. And so we wanted to start a conversation as a church, and we wanted you to know that there is help and resources available to you, which brings me to a good friend of mine, the lovely Sea McCann, who is there to my left or right, whichever way this is on your device. And I asked her to join me today and just have a conversation about the idea of mental health. She is in the mental health profession. And so I wanted her to sort of share some things with you, and I wanted to have a conversation and give you a chance to listen in on that conversation. Before we get started, Shay, would you introduce yourself? Tell us a little bit about you and what you do.
I'm a licensed clinical social worker, and I work in private practice where I do counseling for mental health. I also work for hospice and do bereavement counseling and family support counseling. I've worked in an inpatient psychiatric unit for 4 years and have quite a bit of experience in mental health. And so I'm happy to help any way I can.
That is awesome. Now, let me just start by asking you this: like, is this really even a big deal? Seriously, like, you hear sometimes people talk about mental health and they'll even put the word crisis behind it, right? Like, this is a mental health crisis. We are in a global mental health crisis, and some people would even suggest that everyone and anyone has some sort of need for mental health assistance in some capacity. And so I wonder sometimes, without trying to be insensitive, is this a problem that we're making too much of a deal of? Are we not making a big enough deal about it? I mean, talk to us a little bit about just mental health in general. Is this a big deal? Is it a crisis? From your perspective, what are your thoughts?
So I look at mental health the way I look at physical health and spiritual health, right? Because we are mental beings, we are spiritual beings, we are physical beings.
Right.
So any one of those is when you get yourself in trouble, right? So mental health needs to be prioritized the same as your physical health. We don't hesitate to go to the doctor if we're not feeling well, or just for our general checkups. Even if
Right.
we're fine, we take care of that. We come to church, we read our Bible, we interact with other believers to take care of our spiritual health. We also take care of our mental health. So yes, it's very important. And I do think that we probably are in a mental health crisis, especially with the pandemic. And as you mentioned, we don't even know what the outcome is going to be from all the isolation and the regulations, especially with younger children and their crucial developmental years, being isolated from their peers and just living through a pandemic in general. And even those of us who still remain working in the field or working in public, there are a lot of changes because of this pandemic that can definitely impact our mental health.
Yeah, we were talking before we hit record about that specifically. There's so much debate around the pandemic. I mean, there's so many different things we could argue about as it pertains to the pandemic. And you hear a lot of things politicized. Then you hear a lot of discussions over physical health and what's good for your physical health and what you should do or shouldn't do or whatever. And yeah, as I've talked with more and more professionals in the field, they seem to be equally, if not more, concerned with the mental health side of things and the repercussions or just the effects that the pandemic will play on people's mental health. And I know, like, for myself, just being in ministry for over a decade, I've seen people struggle. I've done funerals of people who have committed suicide. I've seen sort of the dark side of mental health struggles. And but what I wanted to ask you about, as it pertains to your private practice, when you're counseling people, do you see people who are simply struggling with anxiety, depression, they're a little sad? do you see people who are really like clinically diagnosed with something, or do you see people who have encountered some sort of real trauma? I mean, what is the scope of your, without being too specific? I know that you obviously have confidentiality issues, but where would you say a majority of your patients land on that, from I'm a little sad and I need some help, or they're at like a really big time of crisis? Where would you say most of them land?
I haven't seen every diagnosis in the DSM. I've seen it firsthand, and I know DSM. It's a diagnostic and statistical manual for mental illness. It's what we use to actually diagnose our patients or our clients. But on average, I think the majority of what I see are everyday people who are experiencing life. Right? Everybody. I always say this: everybody has stuff. I don't care who you are. I don't care how much money you make. I don't care how great your relationships are. Everybody has stuff. And so when those people have these life events, whether it's just seasons in life, changing from one season to the next, becoming an empty nester, having a baby, changing jobs, getting married, all these things that are good can cause stress. And so sometimes it's just people kind of trying to deal with those stressors and learn healthy coping skills on how to approach their changes in life, or they're experiencing some sadness, a grief, a loss, some kind of relationship conflict. And so I kind of help them navigate through those changes and help them learn some interpersonal relationship skills and some healthy coping skills.
Yeah. And I was sharing with you a little bit, at the risk of sounding insensitive, because it probably will come across that way. I don't know if it was the way I was raised, or it's the athlete in me, or it's just wired in me. I'm not really sure. But I've always sort of kind of been the suck it up and get over it type. Like if I'm sad, or I'm in a bad mood, or whatever it is, or even when I encounter somebody who's a little bit sad, or whatever that is, I don't know what it is about me. I'm just like, come on, man, get over it. However, obviously there are issues that can be underlying and things that can be happening beneath the surface that we're unaware of. And obviously I'm not advocating that approach is the most healthy. But would you say that a majority of people, if not all people, probably need a little bit of help in some regard? I mean, maybe for the person watching this that's like, I can't believe that y'all are talking about feelings, and like talking about your issues. I mean, seriously, pick yourself up from the bootstraps, get over it. I mean, what would you say to that mentality, that person that says this whole thing about talking about it's not going to do anything, whatever? What would you say to that person, to that mindset?
Well, first of all, I'd say to the suck it up. Yeah, you have to like correct our thinking in ways and kind of get ourselves past things. But if you're a human and you're breathing, you can benefit from seeing a therapist. Like mental health, just like I said before, is essential, just like physical health. Um, so if you were having uncontrolled blood sugars, we wouldn't approach that person to say, suck it up, like just suck it up. Going to say, well, maybe you need to see a doctor. Maybe you need to get on some medication. Maybe you need to make some life changes. And I think it's the same with mental health. Yeah, sometimes we have to see a doctor. Sometimes we need to see a therapist. Sometimes we need to make life changes. And I'm very holistic in my approach, and I'm always an advocate for nutrition and how it impacts our thinking, our emotions, getting enough rest, healthy coping skills, all those things as part of self-care, very important. So I
Sure.
think totally, and balance everything out, and look, and we need to begin to look at mental health the same as we do physical health and
Hmm.
spiritual health. Um,
Now,
it,
what about the person? I'm so sorry, but I was going to ask you, what about the person who maybe not is of the mindset of suck it up and get over it, but the person who's like, I might need help, but how embarrassing to go to a therapist, to admit I need therapy, to admit I need counseling. Like, people are going to look at me different. There's a stigma attached to it. I mean, how would you encourage that person who might be watching?
there is a stigma attached to seeking mental health services. Unfortunately, we still have that. I do feel like it is improving. Um, Back in the day, you just never said therapist out loud. And still I will hear people in public even like, oh, my therapist told me this or my therapist told me that. And I think we're getting there where it's not quite as stigmatized, but
Sure.
I would say seeking mental health again should be no more embarrassing or difficult than going to the doctor and saying, hey, my heart rate's irregular or I'm having headaches. It's part of who we are. We are physical and mental beings. As a Christian and as a Christian therapist, I hear people sometimes saying that they are fearful of judgment for seeking help meant for mental health or prescriptions. And I always reflect back to that. Would you be ashamed, or would your family be ashamed of you for being on a blood pressure medication? Sometimes medications are needed, not always. Sometimes we work through it and we learn coping skills and we get past whatever it is. But sometimes there's a biological reason why somebody's having a symptom, in which case, there's no shame in seeking medication if that's needed.
Sure. Now you mentioned the idea of one being a Christian in this mental health crisis, and obviously we are a church. We are primarily focused on your relationship with Jesus Christ. We are in the gospel proclamation business, and we are all about preaching the gospel because we know it is that message that directly affects a person's eternity, right? So I mean, we at the end of the day, that is what we do as a church. This is simply we want to have this discussion, all the while keeping in mind that it's the gospel of Jesus Christ that should inform all of this. But for the Christian who has heard things that are not true, things like to receive help and counseling or therapy means you don't trust God, means you don't have enough faith. If you are sad or depressed or anxious, that means you need to pray more, you need to have more faith. Obviously it's the enemy just messing with you, whatever it is. So there's all of these things that unfortunately preachers have said, Christians have said historically, that are either untrue or unhelpful or both. And so I know what I would possibly say to the person who says, I'm a Christian and I'm struggling with A, B, or C. You're saying I need to maybe pursue some mental health resources like a counselor or a therapist. But I've been taught my whole life that to do that would mean I don't trust God, I don't have faith. Doesn't that mean that I'm not a real Christian if I really have these kind of things going on? What would you say to that person?
I would reflect back to would you receive it the same way if it was a physical issue you were having? If you were having headaches, does it mean you have lack of faith because you go to a doctor because you're having migraines or because you break a bone or any number of physical issues? It doesn't mean you have no faith or you're not close to God. I do think there are spiritual issues that can cause heaviness, right? So we're told to put on the garment of praise for the spirit of heaviness. And I believe if, you're having a moment of sadness, those things, it works, right? But I had somebody tell me who was going through postpartum depression that someone told her not to seek mental health counseling because she just needed to put on the garment of praise for the spirit of heaviness. And yes, that is scripture. And I do believe in focusing on the positive, being grateful for what we have. But when there's a biological reason for what you're experiencing, you need to approach it biologically and spiritually, not neglecting either one of those things. We got to consider ourselves as a whole person all the
Yeah.
way around.
And God has given us an abundance of resources, and common grace is what Bible teachers or theologians would call common grace, are things like doctors, nurses, counselors, things that are available to those who love God and to those who hate God. And unfortunately, those who love God often neglect the common grace and good gifts that has been given to us in creation by God for the glory of God. And so yet that is unfortunate that so many Christians believe that lie and fail to receive the help that they need. And I love that you continue to draw a parallel between physical health and mental health. I think it's a really helpful analogy. For those of you that may not know, my wife is a nurse that primarily and only works with the physical. She does a lot of post-op and recovery and things like that. And what my wife often does with me and what she tells other people is she's in like the symptom management game where she manages symptoms. But it is so important to understand, diagnose, and treat the source rather than just the symptom. If you just keep attacking symptoms and you never really arrive at the source, then it's going to rot you away from within physically. Would you say the same is true mentally? Would you say that with all these parallels that you're drawing between the physical and the mental, would you say that there are underlying things that can rot us away from within, but so often we just focus on the symptoms that those cause? Talk to me a little bit about that.
Sometimes when someone's dealing with an underlying issue, it comes out as increased agitation, increased anxiety, depression, frustration, all these things, and they don't even realize maybe why they're so anxious or why they're screaming in the car at the traffic. They just are on edge and maybe not even realizing that there's an underlying issue. Maybe they're dealing with grief. In fact, I see that quite a bit where somebody's grieving and these things are coming to the surface and they don't even realize it's because they haven't dealt with the grief or they haven't dealt with the trauma or the relationship conflict. Sometimes it just comes out, and so they want to attack the symptoms, like you mentioned with your wife and dealing symptom management. But sometimes you have to get a little deeper and go to the core and find out like what's really going on here and how can we really truly heal so that those symptoms manage themselves at some point.
Yeah, I mean, and for those of, I mean, I'm not sure if you are, I know your husband is familiar with the Tampa Bay Buccaneers and the sports world in general. I'm not sure if you're like a standby fan or if you really are a fan like he is.
Get massages during the Bucks game, so I watch the Bucks game for that reason. And the better the Bucks game, the better the massage. It's true.
Well, they have a player on their team, and there's a lot of speculation about what has been going on. But middle of the game, takes half of his clothes off, runs out of the stadium. I mean, there's speculation now. Did he quit? Was he fired or cut or whatever it was? But often that is what we see or we experience is like a blow up, is a crazy just moment of weakness or however it seems, but just seems to be like an outburst or just a crazy moment, not realizing that there was a lot that built up to that, And so as I shared with you before, I've done several funerals of suicide victims and things like that, where, in those moments, I guess you realize in those moments, like this didn't happen overnight, right? This wasn't like this person was healthy and had everything right. And then like the next day, all of a sudden it was all like, there obviously were some things leading up to that. And so when you are working with a patient, are you trying to arrive, I guess, at where they are in that, like help them understand that if they don't come up with some things to help them, coping mechanisms or skills or whatever, if they don't, that trajectory is a bad one. Like that continues to get worse and worse and worse. Are you trying to stop that unraveling? Are you trying to reverse that unraveling? Are you trying to help them realize it? Like, how do you work with that? How do you handle that?
First of all, I do a suicide risk assessment on every single patient, every single time, every time. And some people are afraid to say the word suicide, like it's going to cause somebody to have this big idea, like, oh, well, I didn't think of that. Maybe I'll try that. But as mental health professionals, we realize that saying suicide doesn't make people commit suicide.
Okay.
So I an assessment every single time I see a patient. Are you having any suicidal thoughts? Have you attempted suicide or non-suicidal self-injury? But certainly I have that conversation with people to know that this is why we take care, kind of like what you're saying with your wife. We take care of the symptom and find out what the source of the problem is so that it doesn't become this massive problem that then we can't bounce back from. Where if you have a physical problem and you go in right away, a lot of times there's treatment. We can fix this. But if we let something grow inside of us or we let, some kind of infection continue, at some point it's not fixable. And it gets to that point where is suicide or even with relationships. You mentioned like little things kind of building up and then all of a sudden it's like relationships. You have to deal with that every single day. You have to cope with the challenges of living with another person or having an interpersonal relationship with other people. if you don't address those things on a regular basis, that's when things blow up. And then all of a sudden there's divorce out of nowhere. And people are like, well, it came out of nowhere. Well, it didn't
or
really
an
come out.
affair, or I've seen, like I said, I've seen guys in ministry, I've seen particularly guys in ministry, I've seen people in life just step on like what I would call a moral landmine because they're so done with life. They don't see a way out of their current situation. So for instance, you'll see pastors, they'll turn to alcoholism or they'll have an affair knowing that that will disqualify them from ministry and they don't have to do it anymore. And it's like, that didn't happen overnight, man. Like that, it was not that you were full of the joy of the Lord, operating in your sweet spot in ministry, working in your calling that God has given you, glorifying God, enjoying your relationship with Him as it fleshed itself out in ministry, and then the next day decide I'm done. Like this was it lasted who knows how long. And so, there might be people watching this that are early on in that, for lack of a better way to say it, that unraveling process, even if it isn't suicide. But if they were to let what is going on in their heart and particularly their mind go unchecked, unsolved, undiagnosed, undealt with, it's not going to lead to good places, right? I mean, it's going to lead to some pretty dark things. And so what would you say to someone who they're watching this video and God quite literally used this video, something you said in our conversation, the light bulb went off and they go, okay, I think I might need some help. I think I need help, but I don't even know where to go. I don't know where to start. I don't know what to do next. How would you encourage that person? What would you say is their natural next step if they're coming now to the realization, I think I might need some help?
Start with, well, depending on your situation, if you have health insurance, you can call your health insurance company, say, hey, I want to see a counselor. I want to see a physician. If you work for a company, most companies have EAP, which is Employee Assistance Program, which they allot. A lot of times it's usually about 6 weeks, I think, of counseling that's free of charge. Your employer is not aware that you're seeking counseling or the reason why you're seeking counseling, and it doesn't have to be related to your employment at all. Basically, it's the support that many employers use to help keep their employees healthy, just as though they provide, well visits for the doctor. So take advantage of that. I know pastors putting together a host of resources. There are local churches that have counseling centers housed right in the church for a very reduced rate. So there are all kinds of resources. The most important thing is just asking for help. And certainly, I'm one of the greeters, the first impressions teams. If you see me when you're walking in and you need a little extra support, like pull me aside. I'm happy to talk to you and help you find that resource. Definitely, you're not alone. That's the number one thing that I think it's important for you to know. You're not alone. And just because you're Christian doesn't make you immune to sadness, doesn't make you immune to relationship issues. It doesn't make us immune to anything. It makes us human. So you're not alone. Don't be ashamed to just ask for help. No different than if you got to go to the doctor for a medical issue. Ask for help.
That is so good, and it's interesting. I don't know if it's funny or interesting, or I'm not really one that's big on coincidences, but as we put together our resource page that we want to have available to you, and not just to you but to anybody you might know, the first thing we put on there is you are not alone. That was just the first thing we said, like, you're not alone. And that is one of the predominant lies of the enemy. You're the only one who struggles with this. You're the only one who's messed up or whatever it is, and that causes you to run further into shame. But what we've done, for those of you that are watching, and by the way, this is a resource that's available for our church, but also for our church to share. So if you belong to our church, but you have friends even that they're out of state, or they go to a different church or whatever it is, feel free to share this resource, and we'll have it in the comment section. But it's 12.church/help. And we have put links to different counseling centers, doctors' offices, hotlines, different ministries that deal with psychiatric, behavioral, and mental health, just a slew of resources. And we would just encourage you to not let a moment pass if you feel like you do need to receive some help, that you'd realize you're not alone, and also that there is help available for you. And if we can be of any help or any source of encouragement, we certainly want to be that. Thank you, Shay, so much for talking with me, for having this discussion, and for making yourself available for anybody who comes to 12. If you see her and you recognize her from the video, go up and say hello, thank her, and chat if you need to. But Shay, God bless you so much. Thank you for the work that you do, and we really do appreciate your time and your insight.
So
God bless.